Hello, everybody. It's 12:30. I'm not sure. I know for sure we're missing Chair Benwick is not able to attend the meeting today. And then we did get an email from Andrea Frosted that she's not able to attend the meeting today. So I'm thinking everybody else should be. So I'll give it just a couple more minutes. I'm not sure on the attendee names who those are.
Commissioner, I think that at the past meetings, Anne has done a roll call for the chair, if you would like her to do that.
Okay, I will, yes.
When you're ready to start, yeah.
A couple more minutes and then we'll call it to order and then I'll do that. Perfect. And then Amelia, before we start, I don't know that is there a chair report that I'm supposed to be doing?
I don't think so.
Okay, I didn't think Ben had one, so okay, perfect. Thank you.
Yeah, and for some reason my screen is not flipping, so there may be someone coming in. You're all sideways right now. So someone's gonna come help me with that in a minute.
Very good. We don't want you to feel like you're on the ship.
Feels weird.
Okay. I think we have enough for a quorum. So I'm going to go ahead and just get us going then. So I've called the July 30th, 2020 Board of Health meeting to order. It is 12:31, and I will see if Anne will do roll call.
Board Member Jason Kenley. Dr. Kenley, I see
I am
that you're
here.
online. Okay.
I'm sorry. I was finishing up with a patient on a phone call real quick, so I'm good now.
Okay. Mayor Kevin Freeman.
Present.
Councilmember Linda Thompson.
Here.
Councilmember Betsy Wilkerson.
Here.
Councilmember Karen Stratton. Here. Councilmember Brian Beggs. Commissioner Josh Kearns.
Here.
Commissioner Al French. Commissioner Mary Cooney.
Here.
Board Member Andrea Frosted said she would be absent, and Mayor Benwick is absent.
Correct. Okay, so do we have an official quorum, Anne?
Yes, we do.
Okay, perfect. Thank you very much. Okay, so with roll call completed, then that goes to the chair report, of which I do not believe that there's a chair report today. So I'm acting as the chair and I don't have a report. So, so we will not have that. The next item is the consent agenda. So we got the meeting minutes from June 25th. And did we take each of those separately? I apologize that I'm not. Okay. So we got the board meeting minutes from June 25th, 2020. We've got the vouchers from June 1 to June 30, 2020, and we've got a contract for Contract Design and Associates. Comments on those?
Move approval of the consent agenda as presented.
Second.
Okay, so I have a motion and a second. Discussion? Seeing none. All those in favor, please state by saying aye.
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 And for the record, it's now here.
Very good, thank you. Fran Fitz has now joined us as well. Thank you. Any abstentions?
Yes, Linda Thompson, financials.
Okay, very good, thank you. And any opposed? So the motion passes with approval with one abstention from Councilmember Linda Thompson. Okay, so the next action items that we have, 5A is resolution number 20-07, adopting a Spokane Regional Health District Health Equity Response. Is there any discussion to that resolution? Councilwoman Thompson?
Yes, I would like to really advocate that we pass Resolution 20-07 for adopting a health district health equity response. And I really appreciated that we did go to policy committee to talk about this. I thought it was a very rich discussion. It's about words and inserting action. I take full responsibility for wanting to delay that vote last month so that we could have a look at action. Because for all the years I've done equity work around all kinds of disenfranchised communities and wanting to make sure we're inclusive and looked at health equity. I felt the need to have action because even though we've had equity policies throughout our community, if it's actually action linked to it and that we implemented those policies with our whole heart and soul, we would not be in the tragic situation we're in today. So I really advocate and thank everybody who's worked on this and advocate that we pass this for the greatness of our community.
Thank you very much. I appreciate that. Councilmember Wilkerson.
Thank you, Commissioner Cooney. I have to echo my co-person on the policy committee, Linda. I was a little frustrated, but the policy came out stronger coming out than what it went going in. I still want to reflect on the outpouring of support, though, for this policy from the last meeting. I don't think we got a chance to really share with everybody. It was really significant, I think. And the health board is a leader, has been a leader. I think this puts us in a position to be a stronger leader in this area. So I fully support this resolution also.
Very good. Thank you very much. And I just want to say, I have heard a couple of comments that that maybe this was unprecedented that we sent it to the policy committee before, but we haven't had a policy like this. And we truly do send any financial policy goes to the finance committee first, before it comes to the full board. So it is definitely, procedure for us to have different resolutions that are coming before the board to go to those respective committees that they should go to prior to being in front of the whole board. So I just want to make sure I make that the point of that, because I know I was one of the ones who talked about having it go to the policy committee prior. And it's just like on our legislative agenda, we have that goes to the policy committee prior to coming to the full board as well. So, this was the first time of having a policy like this versus like a finance policy or changing fees, again, that goes to the finance committee prior to coming to the full board. So I just wanted to make that point as well. Any other comments?
I just want to make a quick point and thank Commissioner Kearns, who was on this committee. He really kind of pushed back and challenged us on what the words meant from a different perspective, and we wrestled with some of that. But I want him to know his input was invaluable, and I really appreciate it. Again, it's stronger because of some of the questions that he asked us going forward. So thank you, Josh, for that.
Absolutely. This is an extremely important document. I think, not only for this agency, but for the community. So, I really wanted to make sure that we could be proud of the product that we put out and the product that we pass here, because this really shows this entity and this community's commitment to the health and well-being of everybody. And so, very proud of it, and want to thank everybody for that was able to attend the policy committee, because I think we put out a fantastic product.
Resolution 20-07, a Spokane Regional Health District Health Equity Response.
I second it, Brian Beggs.
Chair, I think on this resolution, I'd like to ask for a roll call vote on this resolution.
Very good, I can do that. So I have a motion and a second. Is there any other discussion? None. So Anna, I have you do roll call and or do you want, shall I just do it?
I apologize. I didn't hear you. Having some technical issues. You want me to run through the roll call for roll
Yes.
call vote?
Yes, please.
Yes, I can do that. Commissioner Cooney,
In favor?
Commissioner Kearns,
Aye.
Councilmember Karen Stratton.
Aye.
Council President Brian Beggs.
Aye.
Councilmember Betsy Wilkerson.
Aye.
Councilmember Linda Thompson.
Aye.
Mayor Freeman.
Aye.
Dr. Kenley.
Aye.
The vote is unanimous.
Very good. Thank you very much. So we have passed resolution 20-07. Congratulations, everybody. Thank you very much. I think that's a great thing for our health district. So next item is resolution 20-08, adopting the 2021 health district fee schedule. I know that comes through the finance group. Mayor Freeman, do you have any comments or questions or comments for that?
I think as we discussed the last time, or we discussed at the, I apologize, as we discussed at the executive committee meeting for the board, the only changes that we're seeing in the fees this year are in response to some state mandates that we are adjusting some fees upwards for some state legislative requirements, and that we have managed to keep our fees exactly the same. So a thank you to the district for really working at this time to make sure that we're keeping our impacts to a minimum. And so I would say that the adjustments that are presented or that the board sees before them today are in response to legislation that we is outside of our control, but brings us into compliance with state mandates. So the finance committee was in favor of these changes and supports the the resolution as presented.
Any other discussion? Councilmember Wilkerson, I can't even talk to you. Thank you.
Betsy, it's great. So my question is, have the fees ever been attached to some type of index or cost of living going forward?
Typically, oh, I'm sorry. Go ahead.
Go ahead.
I was just going to say, typically, Betsy, the fees are calculated based on cost recovery by the district. So we look at what our actual costs are for providing these services to the public, and we either attempt. We don't have a requirement for full cost recovery, but we do try and get as close as we can for these costs, because primarily they are impacting, or they are derived from two individuals, and so we're trying to minimize costs to the folks throughout the district. So I think that's where we're at. We're not really looking at these as a function of index of inflation or index of costs. It's pretty much driven by what it takes for the district to do work.
Thank you. Thank you for explaining that to me.
Any other comments or questions? Okay, then the chair is looking for a motion.
So move, we accept the 2021 Health District fee schedule.
Second by Linda Thompson.
I have a motion and a second. Any other discussion? Seeing none, all those in favor, please say aye.
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 Any opposed? Seeing none, the motion passes unanimously. That will take us to reports. So our administrative officer report. Amelia.
Thank you. My report today, because I'm going to make sure we have plenty of time for Lindia Wilson to give the COVID-19 response update. I'll keep it pretty streamlined here, but a lot of our operations, as you know, are focusing on the COVID-19 response. We also, with fall approaching, are starting to turn our eyes towards immunizations and the process of working with schools and families to making sure that all children have access to immunizations for the school year, and working with the school nurses. Another thing that's happening internally is that we are doing a lot of work on the budget for the Board of Health to bring that forward to you in September for the two-touch process, so that you'll see it twice. Well, actually, I think you see it in October is the first meeting, so it'll be the internal work will be completed in September. A couple of other things related to the COVID-19 response. The Recovery Committee was joined this week by Dr. Weissman and Dr. Lofi from the State Department of Health. Dr. Lofi's the State Health Officer, and Dr. Weissman is the State Secretary of Health, who spent a lot of time answering questions and talking us through, different things they're experiencing at the state and how they can continue to be a resource for us here in Spokane County. And I'm sure Lindia will pick up on some of that in her report. We are getting a lot of questions related to schools, and Dr. Lofi talked about school guidance coming out at the end of this week. So we're all anxiously awaiting to kind of see if there's any information that we can get on Friday related to that coming out. A reminder to board members is that at the last board meeting, we sent out Title VI forms for everyone to sign and get back to us, which is a requirement for Title VI. And I've only received one of those back, so we'll be resending it. And if you could please send that so that, I don't have to stalk you, that would be great for all of us. Do you want me to segue to Lindia, Chair, or do you want me to go ahead and talk finance, because I'm also up to talk finance as well?
Which, as long as you're, unmuted, I'll just
Okay. Yes, if you've been reading the paper or watching, you know that the commissioners did give us an additional $2 million of CARES funding for the health district, and I also sent that information out based on projections and just wanting to make sure that I keep the county and the Board of Commissioners in the loop related to our CARES funding. We're starting to see an increase that I was concerned was going to take us off of the projections that we made for the first request, because we're starting to see an increase in salary and for our contact tracing, so that those have been significant cost. Our current expenditures were just under $3 million, so about 2.8 million. So we're still fully good with the CARES amount that we have, and are appreciative of the commissioners for giving us that additional allotment. In terms of agency financials, this was also shared with the Finance Committee at our meeting this month. We're about right on track, right? So we're halfway through the year. This is through June 15th, and we've got 48% of agency expenses, 47% of agency revenues, so just about a 1% difference. And you would expect us to be at about 50% because we're 50% of the way through the year. So all of that looks really good. Our board goal of having over 20%, having at minimum 20% in reserves, we're actually at 24% right now, so we do have a cushion in place. So that is the financial and administrative officer report, if anyone has questions. Oh, looks like Karen.
Yeah, Councilwoman Stratton.
Just a quick one. And I'm assuming you probably won't know anything till you talk to the school, you get the school guidance conversation going, but what do they do for when you start looking at immunizations in the fall? How do they connect those services to the schools if the schools aren't in session?
Yeah, we're actually working on what that approach could look like. You know, one of the things that we've done, which has been great, is we've started with the help of the superintendents. We're having a weekly conversation where we all get on. It's a go-to meeting where we all talk about different things related to school openings and what that's going to take. Related to immunizations, I think we have a lot of ideas about potentially doing like some curbside immunization clinics, different, types of, we can't really do like that typical back to school event where because we still need to maintain social distancing. But I think we're looking at how can we be creative around, doing curbside or just, different kind of community-based events. So I know that our immunization staff are working and also looking at the new information coming out from the state. But we've already noticed that the numbers of kids who are getting immunizations through this COVID time has dropped off. So, that's something we're really paying attention to.
Thank you.
Uh-huh.
Any other questions for Amelia? Councilmember?
Amelia,
Hi. Yeah.
could you just expand a little bit on your tracking, what's going on with that around COVID? I'm sure it's in my notes somewhere, but if you just give me a quick little update on that.
Do you mean tracking, like the numbers or the tracing? Or? Okay, so Lindia is up next after me, and she's going to talk about that.
Okay, thanks.
Yep. All right, and so there's Lindia popped up. So I will let Lindia go ahead, and if there are other questions, we can tag team those as needed.
Good afternoon, everyone. So lots of information to cover, but I'll try to keep it kind of high level. Anne is going to pull up our Ics Organizational Chart so I can just show you how we are structuring ourselves during this response within public health. Some of you, I'm sure, were at the EOC and saw the structure out there, but now we've fully brought it back into our agency. So I'll just give you kind of a brief idea of what's going on in these different buckets, and then we can take some questions. So we've been working really hard to build out 2 to 3 deep on each of these areas, and part of that is that staff are really needing some time off, and so we're trying to rotate them out in these positions. We're also trying to get some more duty officer kind of coordination so that on the weekends people can actually get away from their phones. So we have a rotational PIO and a rotational administrative manager, and then we have our duty officer for communicable diseases. We have started putting out the situational report Tuesday afternoons, and hopefully that aligns with the recovery group data and the other reports that's going out. People pull data at different times, and so then it looks different. So we're trying to align that type of reporting. Hopefully you've all seen the situational report that was sent out Tuesday. We're including in that report also County Department of Emergency Management updates, the State Emergency Operations Center, and then the notes from the recovery group in it too. And it's getting very long. You will be getting a survey coming out from a vendor called Constant. So we're doing an interim action review of the public health's response to COVID. And then after this one, we'll probably repeat it like 6 months later. So this is an interim one to give us kind of an idea of how we've been doing. We can make some corrective actions, and then we'll do again at the end of the year. So you can see the health officer is directly tied to the incident commander, and like Amelia addressed, he's working very heavily with the schools and the universities to really help them through how they reopen safely. And he is one busy guy with lots of consultations to various groups. Our safety bucket, we have a safety officer that really helps us within our building to keep our staff safe. And we're continuing to provide education. We do temporary temperature screenings, symptom checks for clients, visitors, and staff. And that's going to continue probably through phase 3. And then the safety officer also does facility risk assessment, and they do it of our building, and then they also do it of my place, and so that corrective actions can be taken if needed. In the communications area, you're probably very familiar with Facebook Live, the newsletter, social media. We have a call center that's going that captures about 60 public calls and complaints every day. And I know Kelly is working very closely with Hamilton Studios to put together a masking campaign for more of the 18 to 29-year-olds. And she's got some great information on that, on kind of what messaging should be coming out there. We have an equity officer, and that is to help us really use that equity lens in all of our work through ICS. We've added some objectives to our response that are very much in line with the equity resolution that you just passed. Staff are very connected to what's going on with housing for rental assistance and mortgages. They're working really hard to make sure that these funds go to the people that need them. And they participate in weekly calls with the Pacific Island statewide group. And last week, or I guess it was the 16th of July, they held the first COVID-19 Equity Task Force meeting, which had lots of participation and a really good discussion. And this afternoon, they're holding the second one. Let's see. Then I'm going to go down to the operations sections and start with the finances. We have sent in a report to FEMA and the Department of Health on how we've spent our initial funds that came through those avenues through June 30th. We have about 150 of our staff that are coding to COVID response in various ways. And with the CARES funds, we have hired about 25 temporary staff that will work through December. It's in the areas of care coordination, case and contact tracing, the business technical advisors, project management, and in our call center. We are currently looking at how we can support lab capacity in the county and beef that up some. And then I've been looking at the 2021 budget process and trying to kind of prioritize the positions that we want to hold over, and then those that we may not have a budget for. So hopefully CARES funds continues, or we're going to have a hard time continuing this response. Logistics. So Spokane County DEM and the Health District continue to coordinate our logistical support together for PPE, staffing shortages, and those type of things. They just put some cleaning supply kits together and distributed out to the Latinx community, and have been working with multiple residential care facilities on staffing shortages. So they've been working with our Ready Healthcare Coalition, our Medical Reserve Corps, and really putting together the process that it takes to exhaust your local resources, put it through the county, then up to the state before we can get any support there. DEM has distributed 322,000 cloth masks, and there are some more coming down from the state that we can also get out to the public. Operations. So surveillance is a key piece of what we do, and our website is updated daily. We are averaging around 91 cases reported every day. And the dashboard on the website has recently been updated for easier navigation. So Betsy, that's where you should go to really find out the latest trends, breakouts by age, all of that. And then we also, of course, monitor healthcare capacity, and it's still at the conventional level. So we're still doing okay in that department. The latest masking survey shows about 93% of everyone is wearing masks over it was the July 18th, 19th weekend. There used to be a difference between males and females, but we're actually doing it the same. So that's good news. In case investigations and contact tracing, we have contracted with the Public Health Institute, and they are up and running with 18 case and contact tracer staff. We also hired 2 epidemiologists and 7 disease investigators. We have about 7 regular staff in our epi unit, and between all of the other departments, environmental public health, the data center, WIC, our STD program, we have about 14 other staff that's doing case and contact tracing. So that brings us to about 48 people that's available to do this work. And we're really hoping that this will catch us up, get us where everything is very timely, we can get to our cases in a timely fashion, and do a great job with that contact and keeping people quarantined or isolated at home. We've been working a lot with the workflow and how that all works together with the care coordination branch and also the business technical advisors. We're each taking a piece and trying to make sure that we have good communication and good referrals between the different branches. Native Health has agreed to follow up on their own cases and do contact notifications of people that come through their clinic, which is very helpful. So we're putting a data sharing agreement together for them. Our biggest concerns in this area is that cases are sometimes not providing us with the contacts that they've had. And without that piece of information, it really is going to hurt our effort in following up with all of those that could have been exposed. And then I did mention the long-term care facilities and their staffing shortages, which is really hard for them. Care coordination continues to do great work with, they've had 144 households that's come through there, and they are working very closely with our community partners like CHAZ and the Zone, World Relief, and SNAP. They've been working with the Marshallese community to make sure that they can support them, and have translated a lot of materials for different populations. We've also identified that our pregnant women and postpartum women that have tested positive when they go to the labor and delivery is a concern. And so we are referring them to our Nurse Family Partnership Program that can then follow up and stay connected with those women. We are entering a contract with Catholic Charities to put together a second isolation facility. So we have one with My Place that can take up to about 50 or 60 clients, but they should be very much self-care individuals that don't need a lot of medical oversight. And what we've found is we really need a place that can attend to those with behavioral health issues and those that are living homeless. So Catholic Charities has agreed to create a facility that should be up and running around September 1. Between the two facilities, we should be able to take up to about 100 individuals. Community testing, we have shifted gears a little bit. We are really trying to use our healthcare partners to increase the testing in the community. And the staff have developed a map to look geographically to see where the holes are at, and then working with the healthcare partners that have clinics out in those areas to get them on board. Unify just opened up 2 low or no income or cost, testing, and they have one on Mission Street and Cook Street. We will continue to provide them supplies and logistical support. And then we're also working with another one that's out in the valley, and potentially a multi-care site out in the valley. We are shifting our staff that were working in the community testing area more to the school vaccines. And we will be advertising basically those school vaccination clinics at the school sites, and then doing the curbside model that we've found is very useful, that has been working really well with this COVID testing. Also, the state is really gearing up and starting to host some calls about the vaccine that's potentially or possibly coming down the pipeline for COVID-19. So one of their overarching goal is to ensure readiness of the jurisdiction's vaccine providers and partners to vaccinate at least 80% of the jurisdiction's adult and pediatric population with 2 doses of pandemic vaccine within 12 weeks of pandemic vaccine availability. So this is going to take the staff some planning and really getting prepared to take the vaccine and get it out to the public. We have hired 4 business technical advisors to work with the schools, businesses, higher education, and childcare to get the guidance implemented. And they have had over 400 requests since the end of May. They have been inundated with these requests, so have really had to triage between low, medium, and high businesses that have the highest risk of transmission, and focus mostly on those high-risk businesses. Just yesterday, we had staff that toured the new medical examination and morgue facility and was very impressed with the capacity there, not only now, but it's also its ability to expand if needed. I think that it. Oh, we did find out that the National Guard is going to stay within Washington and help with the food banks. So that was good news for us because we really have been using them to help with distribution. Questions?
So, Lydia, I have a couple of questions. So, on the isolation with Catholic Charities, in that contract. So you said that there's a capacity, but are we just contracting based on numbers? Because we saw that with EOC that there's just the contract that was just like this big contract and not based on numbers or incremental people there. So how is that going to be structured?
Yeah, so it will be structured that it's scalable. So, they'll have staff ready to go, but we will not use them unless needed. But what's hard about it is we're expecting the fall to get worse. So, of course, we need everything in place now where we may not need a whole lot of it, but have to have it available and ready to go.
Okay, and then my other question would be like with flu vaccines, what for the general public? Just because there's a lot of discussion on people wanting to ensure people are getting vaccinated for the flu, just with COVID and all of that. So has there been a lot, the thought process and the effort for that?
We will continue the way we've done it in the past with our clinic in a box and using university students, our MRC, continue to use all of our pharmaceutical, Walgreens, Rite Aid, and all of those, and keep pushing it out the way we have in years past. So that will be also a part of the staff's work. They also always have flu available at their school clinics.
And MRC stands for Medical Reserve Corps. They're retired, right? They're retired medical professionals, just to clarify.
Right. Anything else?
Mr. Curran?
I had a question. You referenced the mask survey. I think you said 93%. How are those surveys conducted?
So Steve Smith has been coordinating that with some volunteers who then go to the big box stores and things, places. He's on there, Steve, if you want to chime in. And they do observations.
Yeah, so we have worked with our volunteers who initially we had trained up on contact tracing and just moved throughout the county and identified about 50 locations. The volunteers just they have a quick check sheet. They sit in their photos and people walk in, they check male mask, male no mask, female no mask, and then send that back to us after the weekend.
It is so the survey is conducted in the store, not outside the store?
No, it's outside the store. It's
okay.
As they're walking.
Okay, because I was just gonna, I know there's several stores I've gone into where, once the individual goes into the store, they put the mask on, and I just wasn't sure if that's calculated for it. If you were outside, you wouldn't necessarily see that, but if you were camped out inside, you would see that. And I just not sure if maybe you'd get a better, more accurate number if it was done with the individual standing in the store rather than outside the store.
Yeah, I think you definitely will, but it's just a matter of not trying to be intrusive and getting the folks asking.
Yeah. And then you referenced a mask campaign with Hamilton Studio. Is that in conjunction with the Greater Spokane Incorporated campaign, or is this its own campaign in addition to the campaign that Greater Spokane Incorporated is going to be ramping up here very shortly?
Yes. It's in conjunction. We actually, Greater Spokane was here yesterday as part of the Facebook Live. And then Kelly Hawkins has been working directly with GSI so that we're sending out unified messaging around it. So everyone's collaborating to make sure it's really aimed at that 19 to 29-year-old group. So GSI has been kept in the loop and given us feedback along the way.
Okay, so will it be funded through the CARES dollars from the county that the health district received, or the CARES dollars that GSI received?
It's ours. It's the health districts.
Okay. Okay.
Yeah, and I'm sorry, did you have another question? Because I was just gonna do a follow-up from Lindia. So
Yeah, no, I was just going to ask, you referenced you were having difficulty getting contact information from individuals for the contact tracing. Is that because people are refusing to provide it, or people are just saying they don't have the contact information for the people they've been around? Or a combination of both?
It's a combination of both, but they know that if they name people, that then those people will be put in quarantine or isolation, and so they're just not naming them.
Okay.
And it's been really hard to get them to come forward.
Okay. Thank you.
yeah, the one thing that I was going to add, leading the recovery committee on Tuesday mornings, one of the requests has been that we add action items or talk about actionable things into that conversation, which we are. But I want to add that I think that in terms of action, probably one of the best things that as board members and I'm going to tell that group on Tuesday is really just to support the health district and reinforce what we're saying, so like the masking, the physical distancing, all of those things are really helpful when we have folks, giving that same message, but then also, wearing masks when they're in public and all of those things. That would be a really helpful, actionable item that I think everyone could do. That would help the health district. Because there's no magic thing that we can do to stop everything, right? Like, because it's a virus, there's no magic button that we can press or activity we can do that's just going to make it all go away. So it's something that we just need support on. What, Lindia?
We wish we could, but no luck.
Okay, any other questions for Lydia? Dr. Bender?
So if I understood correctly, they were saying that they wanted an 80% uptake of the vaccine for the pandemic once it's released within 12 weeks. Is that correct?
Yes.
Okay, so the question that I have is, right now, the timelines keep shifting on when that's going to be available. And some things are saying we will not reopen until that is available. In these discussions, what are the plans if the vaccine's not available for 6 months or 12 months or 18 months?
We'll continue doing what we're doing now and trying to get people to mask up and social distance and prevent spread just by our social distancing measures. I think the hospitals themselves have learned a lot about treatment, but, it's still a very difficult disease that's having great impact in the community.
Has there been any discussion among the groups that you're in with what it may look like as far as reopening if suddenly the timeline for a vaccine isn't for another 18 months?
I have not been in any of those discussions with it being a year out. I'm sure Bob has at the health officer level, and maybe that's a great conversation for the recovery group.
Okay, thank you.
Yeah, I think currently that's all, the governor is the one who has everything on pause. And so we do talk about that at the recovery group as to, when we're hoping to get to the next phases. So it's something on all the electeds' minds as we continue to look at this and move forward.
Yeah.
Any other questions? Okay, Amelia, I'm going to check and see, do we want to, I know Bob is on another call. So he may not be able to join us, but do we want to hold him off the health officer report until after we do the the Board of Health member roles and responsibility, or do we want to just have Steve go ahead?
No, I think you could go forward with Michelle. It's actually the State Board of Health meeting that he's in right now. And he thought that that would get over so that he would have time to hop on. So if we go forward with Michelle's presentation, then I think we can see if he can get on.
Okay, great. So Michelle, you're up next for a presentation on Spokane Regional Health District Board of Health member roles and responsibilities.
Thank you. I think Anne is going to make me a presenter so I can show my screen, and hopefully I will be able to have you see my PowerPoint. If not, we'll wing it. Anne, are you there?
I am there here. And have you seen that? You should have a message box up saying for you to accept the presenter.
I don't see that, but let me check the view. Or I'm not seeing that.
Dr. Lutz, do I hear you?
You did, yeah, I'm here.
Okay. Are you not seeing it, Michelle?
I'm not. Do we want to come to Dr. Lutz? Unless you want to go back and do Dr. Lutz, and then I can finish up since he's available now.
Okay, why don't we do that? And maybe someone can text you where that box would be. I'm not sure where it is on the go-tos. So Dr. Lutz, thank you for joining us. I know you've been on another important phone call, but we are ready for you to do your health officer report.
Well, honestly, I don't have much to report at this time other than, I think both Steve and Lindy have sort of shared what we're doing both at, within the agency. As I've said, recently, previously, the big issues right now on everybody's radar screen are schools, reopening schools. And so good conversation yesterday. Amelia, Mark Springer, Julie Aubrey, Sandy was on the phone call with school superintendents across the county. And it's our first of what will be weekly phone calls, and provided them as much information as I had available to me concerning reopening schools. Certainly, given the prevailing nature of what we're seeing in Spokane County, but also throughout the state, there really needs to be a strong pivot towards virtual, as much virtual as possible, with in-person education going to be very challenging for the foreseeable future. So that's what we discussed yesterday. And I shared with him that as I get more information, more guidance from both DOH, OSPI, and the governor's office, I will be sharing that as soon as I can.
Okay, thank you very much. I know it's definitely on the forefront of everybody's minds right now as all the reopening committees have been going on. And so, yeah, just thank you, and keep us well. And I'm very excited that you guys are doing the monthly or the weekly meetings now with the that's going to be key. So thank you very much. Linda.
Yes, I just wanted to say how much I appreciate Dr. Lutz, Amelia, the team working on this. I know a lot of people have said thank you, but I just want to say that I truly believe that we are in the best place we can be because of the heart and soul of our health district and those of you who are doing this work and all the electeds and committee folks who are supporting this. I'm truly a community person, and I just feel in my heart that this has been a true community effort, and through very difficult times with mask, no mask, messaging, trying to figure out what is the best thing to share with the community, what's the most, what we can do, given this huge impact on our community, our nation, our world. And I just wanted to say how much I appreciate that everybody is really, truly doing their best work. And then I know we'll come out of this, but sometimes you can lose your enthusiasm and thought that we're going to get get through this, but I truly believe we are, and I appreciate the hard work that's being done by everybody.
Thank you.
Great. Dr. Kinley?
Dr. Lutz, I have two questions that I've been getting pushed on by some other people in regards to data. So I was hoping you could just clarify quickly for me. With the patient counts of the number of cases that we're getting, do we know if any of those are duplicate tests?
They are not.
Okay. The second question is that based on the number of COVID patients that are in hospital beds currently, are any of those patients that were in the hospital for another problem then subsequently diagnosed with COVID? Or are those patients who went to the hospital specifically for COVID-like symptoms, confirmed diagnosis, and stayed in the hospital?
That's a granularity piece that I'm not sure. Every patient that we report as being hospitalized has been diagnosed with COVID. Whether or not they went there for specific COVID-like symptoms, of which, as we all know, there are many, I don't know. But once they're there and they're tested, if they're tested positive, then those are the cases that we're reporting in the hospital.
Okay. So if we have somebody in a bed that went there for a heart attack, like situation, and they're tested, because that's the standard protocol at this point, if they were asymptomatic, tested positive, but were there for a different problem, they're still listed as a COVID patient in the hospital, correct?
Correct. They are, again, diagnosed. They are diagnosed as COVID positive, irrespective of what takes them there. Granted, as we know, there's a variety of presentations.
Okay. Thank you. That's all I needed for the clarification, and I hope you're getting some rest in all this chaos.
It's relative, but thank you.
Commissioner Kearns?
Yeah, this question I assume could probably either be answered by Amelia or Dr. Lutz. You referenced the conversations with the school districts. How I understand it will work is the school districts come up with a reopening plan that has to be adopted by the school board and then submitted to the state for approval, correct?
That's my understanding, yes.
Okay. Have any of our local districts received a response back from the state yet on whether it's been accepted or not, or
I can't speak to that. I know that Central Valley presented theirs to the board, but I have no idea. Commissioner CUNY can probably speak better to that than I, but that's the only one that I know has had a plan that they have presented to the board as of yet.
Okay.
Yes, and it has been approved by the board, and so it is on its way to OSPI. But all those plans are subject to the guidance that's going to be coming out from the Department of Health and our local health officer.
Okay. Okay. Yeah, I just wasn't sure if anybody, who was maybe first out of the gate had received a response back from the state, yes or no at this point. So.
Yeah. Currently, no. Central Valley has not received a response back.
Okay. Thank you.
Any other questions? Okay, Dr. Lutz, thank you very much. I appreciate your update for us and appreciate all the work that you're doing. So thank you. I will turn it back over to Michelle.
Thank you so much. And I appreciate the opportunity to speak with all of you about what I call the art of board governance, because I do believe that it is an art. Over the course of a 30-year practice, I've seen lots of different boards, some small, some big, and some that are way more functional than others. I do know that it's important to be a good leader and a follower on a board. You have to be a team player, somebody who can be trusted, and that inspires confidence in the community that we serve. So I hoped to be able to share with you some of those things that I've seen that worked and things that didn't, and what your roles and responsibilities are. I do want to add a disclaimer, which is, of course, probably expected from an attorney, but this was not developed for any particular organization. So I don't want anybody to think that I am specifically talking about you. It's developed over time. So Okay, now how do we make it? We make it go to the next slide. Okay, that's not helping. And any idea on how to make the slides advance?
Since you should have multiple screens up, it depends on which you are sharing. If you're sharing the slideshow part, you should be able to advance it from the other screen.
Okay, advance it from the other screen. Well, I am not familiar with this, obviously. Well, it's not showing me how to do that. Let me do it. So I don't know, Anne, do you want to take it back and then I'll just talk in the meantime so we don't waste everybody's time?
Yes, and I can advance if you let me know.
Okay, will do. Would you advance, please?
I need to share from my computer first. So it'll be just a moment.
Okay. So the major topics I wanted to cover are to talk about the roles and responsibilities that you have, and then the characteristics of an effective board. So I think the first thing to talk about is what is the role of an individual board member? The board, as you know, sets the policy for the agency. And that's really the big picture. You know, where are we going? How are we going to get there? I think importantly, how are we going to pay for it? And then as that policy is developed, it is passed through to the administrator who then makes that happen. Okay. What is not the responsibility of the board is to do the day-to-day operations of the health district. That's Amelia's job, and through Dr. Lutz, his job, and her other supervisors and directors. So we want to be sure that, oh, good. Now if you can advance about 3 slides in, that'll be super. No, we don't, the board doesn't individually supervise contracts or manage personnel other than the administrator or the day-to-day budget operations. So what are some common mistakes that I have seen boards make over the years? Well, the first is to not understand what the role of the board is, okay? So it's important to define what those roles are and make sure everybody knows, kind of like you're doing today. The other mistake that I've seen made is sometimes board members want to take away the responsibility and take it onto themselves from the staff. Okay. So, you know, board members don't do direct performance evaluations other than to the administrator. They don't dole out discipline to staff because that's for the administrator to do. And as an example, there was a case a while ago where somebody who was on the city council decided that he was going to take matters into his own hands and fix a pothole because it wasn't getting done timely. And this was not Spokane. And so he just took some of the asphalt from a city vehicle and went out there and fixed the pothole. And he ended up being charged with misappropriation of government property because as a board member, he doesn't have any greater right than a member of the public to go and take a city resource and put it to its own use. So that's kind of an example of how there is a limitation on what it is your role and responsibility is as a board member. So the other mistake is board members believing that they individually get to act on behalf of the health district. The board speaks with one voice, not 12 individual voices. And so the board has a discussion, takes a vote, and then that is the will of the board. And you can see why it could be problematic if you had individuals out there, individual board members giving individual direction, because staff suddenly have 3 or 6, or in this case, 12 different bosses that may be giving different and conflicting direction. That's why it's important that the board speaks with one voice. Okay, Anne, can you skip ahead to where you see pictures of football players? There we go. So one of the analogies that I like to use is of a football team. You know, it is not the role of the board to be the person on the ground running the plays. It is not even the role of the board to be the coach deciding on the plays. You all are more like the team manager, where you're setting that 10,000-foot view and managing the district, managing the team as a whole. Okay, next slide, please. Thanks, Ann. So as I said, I've been watching boards for about 30 years now. And there are certain characteristics of boards that I see that make them effective and respected, and they get things done. I was going to rank these like top 10, but then I decided not to because they're all equally important. I would also say that every board has its own personality. And I think it's good for you all to know that, because you probably don't see it as much as maybe I do or the staff does that's been there for a long time. But as you have new board members come in, the personality shifts, and sometimes that takes a little while for all of us to understand what your priorities are. And we all try and adjust as quick as we can. All right, next slide, please. One more. And you can hit the next one too, Anne. I would say one of the most important things, though, is you leave your ego at home. This is not an opportunity for each of you to show how awesome you are to everybody else. It is instead important to put the good of the board first, and the good of the agency first, and even the good of the staff first. Think, servant leadership. How do we do that? Don't miss opportunities to tell staff or each other how great that you're doing. And I was so heartened to see that today, both between board members and also to staff. By doing that, you create a scenario that unites everyone rather than divides. And it also gives staff the room within which to try new things and grow, and not be afraid of making a mistake. When I see boards that just beat staff about the head and shoulders because something hasn't gone the way that they thought it would, it makes for an environment where people are afraid to try anything new. We don't want that. Next slide. Personal attacks. I have seen some things on boards over the years that would probably surprise some of you. And so the personal attacks shouldn't happen between board members. And I have seen, comments along the lines of, are you a complete idiot? Did you even read your board packet before you got here? And that's not helpful to anyone. And these are actual things I've heard over the years. I've seen board members talk to staff in a way that is dismissive, like, do you really expect us to believe that type of responses? People may think that you're putting the staff in their place and leading, but you're really just negatively impacting the trust that needs to exist. And of course, respect for the public as well. No personal attacks. There have been boards where people of interesting beliefs have appeared. One that comes to mind is a person who used to come to the board meeting with a lampshade on her head, such that the aliens couldn't read her thoughts. And even in that scenario, which is not something that maybe everyone would believe in, she's still entitled to respect. And this includes facial expressions. You know, some of these are televised. Now we're all doing them by Zoom. And so we need to remember that as well. Next slide, please. Remember, it's public, and you can just start the pictures. And so remember our cell phones. I like this little cartoon. Do you mind if I tape your cell phone to your forehead so I can at least pretend that you're listening to me? Okay. We are very tied to our electronic devices, but we want to make sure that we don't use them disrespectfully. Next one, expressions and gestures. Okay. Very apparent sometimes. People make faces about how they're feeling about things. I had one judge in particular who will remain nameless, who you could read whatever that judge was thinking on their face. And then we'll just say other as the last one. Okay. I don't think any more needs to be said about that. Next. You can put it all up there if you want, Anne. Recognize the expertise that your staff at the health district has. Odds are most of us, if not all of us, don't have degrees in epidemiology or environmental public health or public health nursing or bats or pools or on-site sewage or tobacco or nutrition or HIV/AIDS. But the people at the district do. It is their passion. So listen to what they have to say and respect the knowledge that they have. Okay, next, and along with the picture. Oh, you can keep going. Good. There are always going to be issues that the board disagrees on and that everyone has a strong feeling about. But as I mentioned earlier, the board speaks with one voice. Those of you that are in the military would probably remember this phrase of salute smartly and carry on. My husband was in the Air Force, and he would tell stories about how they would have very robust discussions about issues. But once the decision was made, then the decision was made. And you didn't backdoor or try and undermine that decision behind the scenes. If you wanted to bring it up again, you did it in the appropriate fashion. All right, next. And you can put all of those up there. Remember what our chain of command is. You know, you are the Board of Health. You issue your directives to the administrator and to some extent to the health officer. And then the administrator directs the staff. So it's important to not let staff members skip over the administrator and go directly to the board with their complaints, because that undermines our administrator, not just in this organization, but any, and we want to help maintain that chain of command. Number 7, and you can put it all up there, Ann. Be informed and engaged. A good board member is prepared. You know, you've read your board packet. You're prepared with your questions or comments that you might have. Please don't play gotcha. You know, where you have some big issue or you see a mistake and you wait until the board meeting to spring it on Amelia or Dr. Lutz or the staff. If it's a big issue, let them know ahead of time so they can address it and it can be productive. I also strongly recommend that you learn what people do. If you have the time, go, maybe not now, but go out with staff and see what they do and how they do it. The health district personnel do an amazing variety of things in the community. And one of the, I guess, the catch-22s of being in a health district is when you are doing things well, everything is going smoothly, and people don't really even know you're out there. You know, if people aren't getting sick in restaurants, it's because health district personnel have been out there making sure they're following the rules. Volunteer for committees and then attend those public events that involve the health district to show your support. Number 8 is one of the ones that is most important to me, and that is that we maintain confidentiality. And you can put all the sub-headings up there if you want. Be reminded that whatever happens in executive session is confidential and not to be discussed outside of executive session. In fact, in August of 2017, the Attorney General's office issued opinion number 5, confirming that participants in an executive session have a duty under the Open Public Meetings Act and the Code of Ethics to maintain confidentiality. And we've had times where people are not as careful as they need to be. For example, someone might run into a board member at another event and they are talking to one to the other about what happened in executive session, but other people can hear. So you just really have to be cognizant of confidentiality, and that includes your notes and the documents that you might get during executive session. Okay, you may be provided with information that's protected by HIPAA or personnel records, and so we don't want you out there blabbing. My personal favorite is the attorney-client privilege. The advice that I give you is confidential so long as you don't share it with a third party. Once you do that, you waive that attorney-client privilege, and someone may be able to get beyond the privilege and find out what we talked about. And I see from time to time in emails, Michelle said, or our lawyer said, and so be really careful of that. Number 9, remember what hat you're wearing, okay? When you are making decisions as a health board member, your hat is for public health. And I know many of you wear lots of hats, and so that can be challenging. But again, the board speaks with one voice. And so it's important that you not be out there just acting as an individual, but trying to wear your Board of Health hat. And last but not least, communicate. We need to talk to each other so that we know what's going on and what's important to everyone. I don't see this on this board so much, but I've been on boards where people interrupt each other and they yell at each other, and you just can't get anything done in that way. So those are the characteristics. I'm going to talk now about conflicts of interest and ethical issues, because that's an issue that I promised you I'd talk about. So next. So a number of years ago, the legislature decided to codify the conflicts of interest and ethical issues for board members. And they did that for about 4 reasons. One is to make the rules uniform so that everybody would know what they are. There were certain things they wanted to be sure and prohibit. And they wanted to make it okay to have some remote interests so that we didn't overly limit the group of people that could serve on these type of boards or be in public office. If they became too restrictive, then we start not having anybody who can meet the criteria. So let's talk a minute about the definitions, because they're broader than you might think. Go ahead and put up municipality and the municipal officer. So for purposes of the ethics rules and the conflicts of interest rules, the district as a special purpose district is subject to those rules. Okay, so all of you on this board are subject to those. A municipal officer is defined not only to include each of you, but deputies and assistants and people undertaking or exercising the powers of the municipal officer. Okay, so it runs a little deeper than you might think that it would. So next slide, what you can't do. And you put up all 3 paragraphs if you would, Ann. You don't get to enter into contracts in which you have a beneficial interest, okay? If it's made for you or under your supervision or for the benefit of your office or you're getting money, then you don't get to have those types of contracts because it's a conflict. Okay? There are a few exceptions, which are on the next slide. And you just put them all up there, Ann, if you would. Many of them don't directly apply to this board, and I didn't put them all up here, but two that I did want to mention are, we are employing a person for unskilled day labor for more than $1,000 a month, then that's excluded. If it's less than 1,000, then it would be okay. And then contracts for less than $1,500 a month, where the municipality, or unless the municipality is the seller, lessor, contracts for legal services. What's important is whenever any one of you think that you might have a conflict of interest, your safest bet is to disclose it publicly, make sure it's recorded in our minutes, and then don't vote. Okay. Even if an exception applies, you still have to disclose that, but then you can vote if it's an exception. So let's talk next about remote interests. And this, again, as a reminder, is the legislature's effort to say, all right, we know that, responsible professional people are going to be involved in other things, and we want them to still be able to hold public office. So remote interests that are allowed are, if you are an unpaid officer in a nonprofit, that's okay. Probably most of us do that. If you are an employee of a contracting party and your wages are fixed, so you're not benefiting or losing depending on what happens, that's okay. Landlord-tenant is okay. Or if you are a shareholder and you have less than 1% of the shares, then that's considered a remote interest. But again, you've got to disclose it publicly. It's got to be recorded in our minutes, and you can't vote. And in addition, you can't lobby other people to vote the way that you would want them to vote. So you've just got to completely take yourself out of that particular issue. What are the penalties if you violate these rules? Contract might be void. And even, some of you might be familiar with that legal concept of part performance. That won't save you. You can get a penalty of $500. There could be other civil or criminal penalties imposed by a court, and it is a grounds for forfeiture of office. And we have seen cases where there have been actions to try and remove somebody for violations of the ethics rules or conflicts of interest. All right, talk about prohibited acts, and just go ahead and put them all up there to be easier for you. All right, none of you or any of our higher level people at the district can use their position to try and secure privileges for themselves or others. Okay? We don't get gifts, rewards, gratuities. And I get this question sometimes, well, geez, what if it's, cookie and coffee or something like that? The statute itself doesn't have a dollar figure, but the audit $50, it's considered de minimis. So you can't have a job that would require you to give up confidential information. You can't disclose confidential information, and you can't use it for your own benefit. All right, I'm not sure if I kept the examples in or I took them out. So with that, I will stop and I will answer questions that anybody has to the best of my ability.
Any questions from Michelle?
All right. You all just want to go home or go to your next thing.
No, well, thank you for that. I think that was very helpful, and I think we can all learn something. And I think with Amelia being newer, it's again just that good reminder for all of us that we need to be going through Amelia. Not contacting staff directly. Even with relationships we have, that's an important piece that we need to make sure that we're doing as good board members. So, and I think just since we're on board responsibilities and roles, there is a vacant position that I've been taking applications for, that those applications I'll be finally trying to take a look at this next week. It's been a little busy time, so I'll be looking through those, and hopefully by our next board meeting we'll have a new board member. It's my hope. So So with no other questions, Michelle, any other, we didn't really have a board check-in, but I'm going to just go ahead and ask if there's any comments from the board that you'd like to make. No? Okay, so our next board meeting, I think we don't do a board meeting in August. It's our break for August. So our next scheduled board meeting is September 24th of 2020. So with that, and seeing no other comments, I'll ask for a motion to adjourn.
I move to adjourn. That's Linda.
Do I have a second?
Second, this is Karen.
Okay. So I got a motion and second to adjourn the meeting. So all those in favor?
Aye.
Aye.
Any opposed? So the meeting is adjourned and we'll see you guys back in September.